Let's talk hospice today and when a person living with dementia may be ready for this final stage of care. So, first off, what is hospice? There's a lot of misunderstanding. Hospice is not just where someone goes to die. Hospice care is directed at providing comfort to people who are reaching end of life. And it can be provided in a person's home. Someone can stay at home, or it can be done in a care setting. And Medicare covers hospice care for the final 6 months of life. So that's why we start thinking about hospice care when there's a guesstimate that a person has about 6 months left to live. So it's a little easier to predict, end of life, for example, when someone would have cancer and they are not responding to treatment any longer. But with dementia, it can be a little more unpredictable and a little bit more vague. So today I'd like to talk to you about some of the signs that you may see in your person that might signal that a hospice evaluation is appropriate. And I say hospice evaluation because, unfortunately, people don't just get to enroll automatically when they feel like it in hospice. They have to be evaluated, and then there's a kind of a set of criteria for admission. So a hospice agency, which sometimes is tied into a home care agency or another medical system, needs to review the case of each patient before they admit them. And they have to make sure that their clients are meeting a certain set of criteria. And I'll talk about what that criteria is for dementia just a little bit later. But just a few general signs that we see in people who are likely entering the final stages of life. In families or people closest to them are going to start notice these things. So things like eating less or being able to move around less. They're less ambulatory. Maybe they're even bedbound. They're sleeping more. They begin to speak less. They may even start to seem a little bit withdrawn, or they may experience an exacerbation of their dementia symptoms. So things like more anxiety, more confusion, or more hallucinations if they've been experiencing those in the past. And then there'll also be signs of physical decline. Remember that brain is kind of grand central station, and when it's losing connection with the body, there's going to be things like more incontinence. There may be less signaling of hunger and thirst. So like I said before, you might see a decrease in appetite and intake. And very commonly, people are going to lose control of that swallowing mechanism. So you may see them having difficulty managing their own saliva, so they may start drooling or they may cough a little bit after they've had something to drink or eat, and that's just a sign that they're aspirating. So food or fluid is going down the wrong tube and ending up in their lungs. So then we start seeing an uptick in infections like aspiration pneumonia or urinary tract infections, and there's just going to be more frequent hospitalizations or trips to the doctor. And of course, other times people living with dementia just have other medical conditions like heart disease or lung issues, cancer, or a lot of times we'll see them fall and they fracture their hip, and then families are left to kind of weigh the pros and cons of treating the conditions. And if the treatment really isn't going to lead to a huge improvement and it may cause a lot of discomfort, sometimes they decide instead of treating to just allow natural death to occur, and then that's when hospice would come into the picture to help the patient and the family just navigate these final stages of life. But if there's not a condition, another condition or an accident, and dementia is the primary diagnosis, I just really encourage you to talk about hospice as soon as you have the question. If you have a question about whether or not it's appropriate, talk to your doctor, your medical provider about it. Bring up the conversation, because I think our medical system is really geared toward curative approaches, and hospice is underutilized at the end of life. And that's not only my opinion. There's been some research. Actually, there was the hospice and palliative care report out a few years ago that said the median usage of hospice, the median time was 18 days. So families and patients are just leaving a lot of extra support on the table when they could actually be receiving services for 6 months. And what services are those? So hospice brings in a care team that's pretty large, consists of nurses that are really familiar at dealing with end of life. And it's not just for pain, right? Sometimes in dementia, we don't see a lot of pain, but we'll see increased anxiety or breathing difficulties. And comfort could come in the form of other things like massage therapy, healing touch, chaplain services to address spiritual needs, music therapists, volunteers that will sit at bedside. There's also something called an end-of-life doula, and a lot of hospice agencies are introducing this into their volunteer team. And end-of-life doulas just hold space for people to talk about dying and prepare people for kind of what they're going to see as a person begins to go through that dying process. Hospice also brings in nursing assistants to help with those hands-on tasks, bathing a person, getting them up and out of bed. They're going to be able to bring in more equipment at no cost to you, hospital beds, comfortable mattresses, these chairs called Baroda chairs, B-R-O-D-A. You'll see a lot that are kind of a combo recliner shower chair. So there's a lot of benefit that's available. And hopefully people will use this benefit longer than 18 days. So here are the criteria, like I mentioned before, for qualifying for hospice with a diagnosis of dementia. Number one, person is going to be needing assistance with almost all of their ADLs. They're going to probably be more incontinent, less alert, more sleeping, less speaking, a decrease in their swallow or eating ability that leads to weight loss. And they'll also probably have some medical complications like we talked about before, pneumonia, urinary tract infection. And specifically for dementia, you'll often see the person who's doing the assessment use the FAST, F-A-S-T, or Functional Assessment Staging Tool for Dementia to determine if a person needs criteria. And if you're interested in more in learning about the FAST, I did a video on this, and you can find that here in the video library. But a person would be scoring about a 7 on the FAST scale, which is the severe dementia stage. But there can be variations and exceptions because we are all different, right? So for example, I had a client with frontotemporal dementia, FTD, who had the symptom of compulsive eating. So she wasn't losing weight, she was gaining weight. But instead of having this disqualify her for hospice, fortunately the person doing the evaluation just recognized this as a sign of worsening dementia rather than sticking firmly to that weight loss criteria for admission. And in other cases, I've seen people accepted for hospice that still have, some function in some areas, like maybe they're still walking a little bit, but they have uncontrollable anxiety, or there's a sign of severe aspiration, and families are just deciding that they want to focus on comfort. This is what their person would have wanted. And so rather than inserting a feeding tube and worrying about them pulling it out, they decide to not do that and enroll the person in hospice. So I guess my best advice to you is if you notice a decline in function or an increase in symptoms, of course, hopefully you're talking to your medical provider about this anyway, but ask about hospice and whether the doctor or the provider thinks it's time. And if they don't agree with you and you feel in your heart that something has changed, just ask for an assessment. It doesn't hurt to have a hospice assessment. And even if you're not accepted into hospice, they're not ready yet, the person doing the assessment can explain why not, and when they would qualify. And after living with dementia, it is my hope and prayer that we can exit this world with as much grace and peace as possible. Well, after that heavy topic today, it is time for our meditation. So let's just go ahead and start getting ready for our break for 8 meditation. So please find a comfy place to sit. And actually for today's meditation, I'd like you to remain in a seated position and plant your feet on the floor. Let's begin by just taking a few gentle breaths in and out. And as you breathe in and out, just draw your attention, bring your awareness to your core. Just be mindful of the way your chest rises and falls. Let's begin to just block out all the distractions around us, all the noise, all the chaos that can come along with life, and especially when dementia is part of life. Just finding this moment to take some time to create some space around you, a barrier from the rest of the world. As you breathe in, I'd like you just to sit up a little bit taller. Just think about kind of a golden thread just attaching itself to your head and pulling your spine up, elongating your neck as you relax your jaw. So your chin is up, your shoulders are back, but gently placed back. And your spine is as tall as you can make it. And your feet are firmly planted on the ground. Just continue breathing in and out from this place of stability. If you notice an area of tightness or an area that is holding tension, just send a few breaths to that spot and realign your core. I'd like to teach you a quick grounding technique. The first part is to place one hand on your forehead and the other hand behind your head, as if you were just gently holding your head in place. If you like, you can even try holding them a little bit away from your head, just an inch or so. As you hold your hands here, you still should be able to sense the presence of your hands, even though your eyes are closed. You could feel the heat of your hands, or just know that something is there. And now let's just place your hands gently against your forehead and in the back of your head again. Just gently place them there. Let's just hold your head a little longer here. Just imagining the warmth of your hands just kind of melting away any negative thinking. And now I'd like you to bring your hands to your heart. Just resting them gently, both hands on your chest. And again, I'd like you just to sense the presence of your hands. You can experiment if you like, bringing them a little bit away from your chest. And what I'd like you to do is just kind of circle your hands a little bit around that area. Don't worry which direction you're going in. And as you do this, you may feel just a little energy entering your heart area, or you may not. No worries. And now just bring your hands back on your heart where you can feel them gently resting there. Let's breathe into this space and out. Rather than stuffing these emotions, I invite you to place your hands on your heart and just allow them to be there. So often in dementia care, we do not have time to process how we're feeling as we rush through the day. So just take a moment to sit with your heart. Allow it to nurture you for a change. And now I'd like you to bring your hands to your hips, wrapping your thumb and then your fingers around your hip bones and just applying a little bit of pressure so you kind of feel them kind of pushing into your pelvis. And with this pressure, just feel a little extra support and stability it gives to your posture. And from this position, I'd like you just to breathe in. Imagine that breath coming up from the center of the earth through the bottoms of your feet to the top of your head and back down again. You can do a shortened version of this meditation whenever you need to. So when you have thoughts that are swirling and spiraling through your head, just place your hands on your head and hold it for a moment. If you have emotions that want to reveal themselves, just place your hands on your heart and send love to yourself. If you feel an utter lack of stability in your life, try placing your hands on your hips and applying a little pressure just to stabilize your core your center. And let's bring your hands wherever you like. It might be on your lap, they may be palms up, palms down. You may have prayer hands in the center of your chest, or you may place your hands back on your heart if you like. Wherever you feel to be able to recenter yourself, just put your hands right there and take a deep breath in and a deep breath out. One more in and a long breath out. Good luck today. You've got this.